Hello, welcome to our Veteran Town Hall. We are very, very excited. Today, we are live on location at the VFW 3176 in St. Roberts. I am joined today with some of my executives, and they'll introduce themselves as they speak. But I just wanted to say thank you for spending some time with us. As you notice, we don't have masks on today, and we'll be talking a little bit about COVID and our COVID updates. We are all proud to say that we have been vaccinated, and so we are staying safe, but able to allow you to see our faces as well. So I am not going to spend too much time talking about too many things right now, because I would rather turn it over to Dr. Wynn, who is our Chief of Primary Care, to talk about some of our new services.
Thank you. And again, my name is Dr. Richard Wynn, and so I'm the Chief of Primary Care at Harry S. Truman VA. And so we look over primary care at the Columbia location as well as all of our CBOCs. So today I wanted to go ahead and talk to you guys and introduce a couple of new services and new programs that we have. So as far as new services, one of the biggest things that we introduced is the OB-GYN. And really it's the gynecology service. With this new program, new service that we're offering, we're able to do more abnormal pap smears. We're able to also do a lot more gynecological services, such as biopsies, as well as different contraceptive options such as IUDs and Nexplanons and different forms of contraception that weren't available to the VA previous to this. As far as the gynecology service, another service that comes with it is the pelvic floor therapy. So although the majority of these services are geared towards females, there are also services in the pelvic floor therapy that can help male veterans as well, especially for male veterans with incontinence issues. But for females, it is very beneficial for bladder retraining and various types of pelvic pain. And then the other new service that we're offering that we're very excited about on a different note is robotic surgery. So we do have our new Da Vinci robot machine that will work for prostatectomies, hernia repairs, nephrectomy, but we're also offering new robotic bronchoscopy. As far as some new programs that we're offering, these programs have actually been around for a little bit now, but they've expanded with the Mission Act. So the first program I wanted to talk to you about is the Program of Comprehensive Assistance for Family Caregivers. So this program is a program that has expanded since Mission Act. It requires an application, the 1010CG, and it currently is available to post 9/11 veterans and veterans prior to May 7th of 1975. Please be aware that this program is coming out in tiers, and it will actually have another tier opening up to more veterans come October of 2022. As far as qualifications, there's a service qualification, but then there's also a clinical qualification. As far as the clinical piece, that is something that is reviewed at our VISN level, and it looks at each veteran and the services that they clinically require. As far as the service piece, it is a requirement to be 70% service connected or higher, and requiring at least 6 months of continuous clinical care. The caregiver for this program must live with the veteran, unless you are a family member. If you're a family member, you can live separate, but ideally this is a caregiver that lives with the veteran, and the caregiver has to be providing assistance with activities of daily living, such as bathing and using the restroom and feeding. The services provided in this program include a monthly stipend as well as access to CHAMP VA if eligible. It also opens the door for enhanced respite as well as certain beneficiary travel. There's also mental health counseling, caregiver training, ongoing monitoring, and then as well as all the services available through the program of general caregiver support services. So on that program, I did want to also point that this is a separate program, although they go hand in hand with the comprehensive assistance for family caregivers. So the caregiver support services, this one does not require an application and is open to all caregivers of veteran, regardless of their service or the era in which they served. And the caregiver does not need to live with the veteran. As far as this program, it is really complement to our comprehensive assistance family caregiver program in that it gives you specialized support groups and training for the caregivers, including online workshops, support groups, whole health coaching for caregivers. We have a caregiver corner where caregivers can contact our specialists and talk to them about different ways in which we provide care for our veterans. We also do suicide prevention training for those caregivers and individualized support and education for the caregivers. So those are two programs that have been around but have expanded with the Mission Act, and we're definitely excited to share that with all of our veterans and their caregivers. Okay.
All right. Good afternoon, early evening. I'm Crystal A. Holt, and I'm the executive of High Reliability. I'm going to give you just a few updates about COVID. So Dr. Hall mentioned masking a little bit ago. Right now we don't have any on, but currently it is still a federal mandate that in all federal buildings that masks are still worn. So at the hospital or at any of our community-based outpatient clinics, masking is still required. So if we were in the facility or in one of our C-box right now, we would have masks on. Even if we are immunized, have had the vaccine, we would still have to wear the mask. Vaccination updates. So we have given out over 31,000 total vaccines, but most of those are 2 doses. So fully vaccinated, we have about 15,000. Veterans and veterans caregivers and staff that have been vaccinated, and then we have a little over 14,000 that have received their first dose. Who can get the vaccine? So all veterans, regardless of their discharge, can get the vaccine. And based on the Saves Lives Act, caregivers of veterans can also get the vaccine, and they just opened it up to children. They opened up the Pfizer vaccine to children 12 to 17. 18 and over can get any of the 3 vaccines, but 12 to 17 can only get the Pfizer. So we're getting all that in place to be able to do that. We only have Pfizer at the main facility. The C-box all still have Moderna and J&J. So if you would like a vaccine and you live close to one of the C-box, then it would be Moderna or J&J. And then at the facility we have all 3. Caregivers of veterans, any spouse with a veteran of that's regardless of discharge or eligibility can get it. We are still doing some pre-procedure testing, but we're changing that up to where we're not having to test everybody prior to having a procedure. And then we're also looking at, right now we've been testing everybody who gets admitted to the hospital, but we're looking at changing the requirements for that as well. We just haven't got everything finalized yet, but that will be coming. All right, I'll pass on to Andrea.
Thank you, Crystal. My name's Andrea Wiggins. I'm the Assistant Director at Truman VA, and I want to share a few construction updates. So on our northwest side of the campus, we have our Community Living Center. We're working to relocate our Community Living Center from the 3rd floor of the VA out on the northwest side. We're currently in phase 1 construction, which will construct 14 resident rooms. Those are single patient rooms, and it's going to be beautiful. That's should be completed in January of 2022. We're excited. We're going to be opening a new unit. It's called our Progressive Care Unit. formerly our step-down unit. It'll be relocating from our 4th floor to our 3rd floor, and it will be targeted to activate on June 8th. It's going to be increasing by 2 beds, so we'll have 14 beds. And with that project, we also modernized and updated both our auditorium and our chapel, which are located on the 2nd floor. A few other projects you might have seen out on our Avenue of Flags as you come in to the main campus. We have a guard shack that was recently installed, and it's to meet part of VA's physical security requirements. That will be coming online soon. And we also are doing some site prep for our Fisher House. We are hopeful that we'll be ready to start construction as soon as Fisher House has accepted and decided to start construction, so perhaps 2023. The slide says 2022, but we are doing site prep right now for the Fisher House, and we have great partnership in the community with the Friends of Missouri Fisher House Foundation helping us with that project. Some other projects that are currently in design are expand primary care emergency department. So that's going to be a 3-story bump out on the west side of our ambulatory care addition. It's going to renovate primary care, expand our emergency department, adding 4 observation beds, also constructing a new GI clinic on the 2nd floor and specialty clinics on the 3rd floor. So that is getting ready to start design, and we are going to be prepared for construction pending funding in 2022. We also have renovation of our behavioral health clinic. It's fully designed, and we're planning for construction of late summer 2021. We also have nearing the end of construction, or nearing the end of design, our specialty care clinics on the 3rd floor. We have the east side that we're finishing out with oncology, as well as we're also adding some pharmacy compounding in our basement area. So we're planning construction for that in the late fall of 2021.
All right, good evening. I'm Paul Hopkins. I'm the Associate Director there at Truman. Without sharing any personal health information, we're open for questions that you'd like to ask us. So we will just take any questions.
Don't see any questions yet.
No questions yet.
I'd like to. Crystal brought up a really good point about masking, and it's a question that we get quite a bit. And that is, you know, the community is starting to allow people that to choose to wear a mask, especially if they've been, or not wear a mask, especially if they've been immunized. But why not our facility? And even other government buildings have changed their regulations. So specifically, in federal healthcare buildings providing healthcare, where patients actually are, we still mask. And why is that? Well, we mask because there are still some of our most vulnerable veteran patients that can't yet receive a vaccine because of their special health needs. And we want to make sure that we don't accidentally spread the virus to those most vulnerable veterans. So that's why we still mask in healthcare facilities. But I really, really recommend that if you haven't had a vaccine, that you have a conversation with your provider about if the vaccine is right for you, because the more people that are vaccinated, what we can call herd immunity, will help us all to get out of our masks and go back to some semblance of a normal life in the future. And I don't see that there are any other questions. We'd be happy to answer any. Otherwise, please remember we're always here to answer your questions. Reach out to any one of us here, and we will, if we can't answer your question directly, we will direct you to the specialist that knows the answer. Anybody else? All right, then. Thanks for joining us tonight. And I want to say thank you to the VFW for hosting this event. That was very kind. Have a good evening.